name is Riya Nimmagadda, and I did research this past summer with Dr. Yvette Gonzalez on how sex differences play a role in how the HPA axis is affected by alcohol and nicotine use. So for a little background information, the HPA axis is a system in our nervous system which regulates our body's homeostasis in response to stress, and it can release hormones like CRF, which is corticotropin releasing factor, and ACTH, adrenocorticotropic hormones, and cortisol. This is all kind of synonymous to our stress and our anxiety. Repeated drug use can dysregulate this function. Substances like alcohol and nicotine activate the axis stress response and reinforces drug-seeking behavior and can perpetuate addiction cycles. Sex differences also influence the HPA response and the substance use, with hormones like estrogen and progesterone, and affect our sensitivity to cravings. However, there isn't much literature reviews out there which focus on these differences. Chronic exposure to alcohol and nicotine and other drugs can overactivate or desensitize the axis and harm the body's natural stress mechanisms. So for just a visual of it, we got our brain, and this is specifically looking at methamphetamine on the HPA axis, and it can alter the function, which then changes your anxiety and depression. And then this is specifically higher in females than it is in males. And this increases the risk of future MA or drug use. And then this could also lead to an increase of CRF, ACTH, and glucocorticoids, which then change the HPA axis. And once again, that's higher in females than it is in males. So as for the research question hypothesis, I was looking at a couple different parts of this. So do sex differences play a role in drug use and relapse rates, if any? And how big of a role is the HPA axis and cortisol levels on substance abuse disorders and relapse rates? So kind of from preliminary research, just the very basics, I found that sex differences, including hormonal influences, lead to varying HPA axis response to alcohol and nicotine, and females generally show a greater HPA sensitivity during sobriety or withdrawal, potentially increasing relapse risk. For my methods, I mainly use Google Scholar and PubMed, and this was literature reviewed, consisted of peer-reviewed journals, preclinical and clinical studies. Some of my keywords included the HPA axis, relapse, sex differences, self-administration, drug seeking, and a couple other ones. The information that I then found was categorized into themes like repeated use, alcohol and tobacco, relapse, and HPA axis. As for my results, I did categorize them into 4 different topics: alcohol, tobacco, estrogen, progesterone, and relapse. So starting with alcohol, the acute consumption did increase ACTH and cortisol more in men, but women showed greater HPA hyperactivity or sustained activity and elevated cortisol during withdrawal. So when under the influence of drugs, men did have a higher level of cortisol, but after weaning off of those and becoming sober, women had that higher level. Adolescent social isolation stress, which is just a type of chronic stress, also was heightened alcohol intake in adulthood in females. As for tobacco and nicotine did stimulate the HPA axis, especially when used chronically, and that led to sustained hyperactivity. So you were just having so much cortisol in you, or increased stress. And women did exhibit a blunted cortisol and ACTH response, which correlated with the higher relapse risk. As for that estrogen and progesterone, estrogen did enhance HPA reactivity, while progesterone did the exact opposite. Women who are in those higher cortisol levels were found to be in the follicular phase of their menstrual cycle, which is the high estrogen, versus the luteal phase, which is the high progesterone. So estrogen did increase your CRH, which is just corticotropin releasing hormones, ACTH, and cortisol, and progesterone did the exact opposite by decreasing drug-seeking behavior, anxiety, and cravings. As for relapse, lower cortisol production can predict longer abstinence from addictive substances, and heightened HPA activity on the flip side during earlier sobriety can forecast relapse. Women with cocaine dependence showed a blunted HPA response, which contributed to a higher relapse rate. So just another example from a different drug. And some studies, however, did show that no sex differences were in cue-induced craving, so that females and males had the same results. Just to summarize these four sections kind of into one and connecting it all together, HPA axis dysregulation from chronic alcohol and nicotine use can lead to a blunted response, tolerance, and an increased chance of relapse. Females did exhibit a greater sensitivity, especially during periods of high estrogen, and that resulted in higher cortisol levels during withdrawal and eventually faster relapse. Hormonal levels and factors can amplify these sex differences, specifically estrogen, which, as I just talked about, increases stress and drug-seeking behaviors, while progesterone reduces these things. And understanding these can explain why females are more negatively affected post-substance abuse use. Some of the limitations that I had when finding sources for this review were that there were very few clinical trials, and actually most of the research was done preclinically on rats and mice. There was a lack of distinction between sexes in these studies, and when they did distinguish them, there was no tracking of the menstrual cycle. And there are very few longitudinal studies past that 5-year mark, especially on those studies on relapse rates. Going into like 10, 20 years would kind of reduce the divisiveness in the field. As for future research, we can potentially investigate if age and hormones really do play that significant of an effect on stress levels, particularly through adolescence and puberty, to see if really hormones do have that effect. And we can compare that from pre and post-pubertal people. More studies with longitudinal data, like I said, to clarify those inconsistent findings. And we can also develop sex-specific treatments which target hormones to counteract addiction and reduce stress-induced cravings. And that can be particularly useful in rehab centers. We can also explore effects of opioids and other stimulants on the HPA axis and those sex differences. Most of the field is focused on alcohol, tobacco, cocaine, and methamphetamines. So to kind of go more into fentanyl and other opioids would expand the field. Thank you so much for listening to this presentation, and I hope you have